Welcome to Phoenix Home Care. Phoenix Home Care extends a warm welcome to you. Your recovery, treatment, and safety are important to us, and we are happy to answer any questions you may have. Our mission at Phoenix Home Care is to be the premier provider in the country of clinical services and management to geriatric patients in a non institutional setting. Our care is guided by a tradition of personnel, clinical, and technological excellence, and we are dedicated to providing the highest quality home based patient care with compassion and respect for each person. Our philosophy and commitment to our patients is that we recognize that you have a unique physical, emotional, and spiritual need in receiving home health care, and we strive to extend the highest level of courtesy and services to our patients, family and caregivers, visitors, and each other. We're committed to leadership delivering the state of the art home health services with identified centers of excellence. And we engage in a wide range of continuing education, clinical education, and other programs for professionals and the public. We're committed to excellence and we strive to create an environment of teamwork and participation where through continuous performance improvement, we as healthcare professionals pursue excellence and take pride in our work, the organization, and our personal development. We believe that the quality of our human resources, our organization, personnel, physicians, and field staff is the key to our continued success. And we maintain financial viability through a cost effective operation to meet our long term commitment to our community. The policies contained in this book are just general information regarding your rights and responsibilities as a home health patient. As state and federal regulations change, there may be additions or changes to this book as necessary. Our complete policy and procedure manual regarding your care and treatment is available upon your request for viewing at the agency's office at any time during normal business hours. Criteria for admission to Phoenix Home Care is that you must be under the direction of your physician. The care must be based on your needs. You must meet the homebound status requirement, and Phoenix Home Care must be able to provide the services required for your care. Homebound. This means you have to have an illness or injury which makes it difficult for you to leave your home. Also, in order to leave your home, it will require considerable taxing effort and an assistive device or assistance of another person. You have had a recent illness or injury or worsening of a condition which requires the care of a registered nurse, physical therapist, occupational therapist, or speech therapist. You are under the care of a doctor who has ordered the treatment of services we are providing. If the services are not medically necessary and specifically ordered by your doctor, we cannot provide them. Care is provided on an intermittent basis. What this means is Medicare will not pay for health care or staff to stay with you for an extended period of time. We will only visit you for the length of time it takes to provide the specific treatment ordered by your doctor. Our services and payment responsibilities to you is that Phoenix Home Care provides a service of a combination of things in your home, all under the direction of your doctor. We work with your doctor, and our qualified staff will plan, coordinate, and provide care tailored to your specific needs. Our services include skilled nursing at $225 a visit, physical therapy at $225 a visit, speech therapy $225 a visit, occupational therapy at $225 a visit, a home health aide at $100 a visit, or a medical social service for $225 a visit. Medicare and Medicaid will be billed directly, and we accept their reimbursement as final payment for the services we provide for you. If you have private insurance, we will bill your private insurance company for the services provided, and you are responsible for the amount indicated on your consent forms. If you have any questions or concern, please call Phoenix Home Care at 630-321-9400. Our hours of operation is that our office is open Monday through Friday from 9 a.m. to 5 p.m., except during company holidays. Our after hours coverage is 24 hours, 7 days a week to ensure you receive adequate medical care. So a qualified nurse is on call to accept patient calls, referrals for service, and to help service patient emergencies as needed. All you have to do is call the regular office number. The plan of care. This agency involves you, your representative, key professionals, and other staff members in developing your individualized plan of care, which is based upon this admission information that we take today, your physician specific medication and treatment orders, and our observations of your personal wishes. The plan also includes, but is not limited to, the following interventions and goals: nursing care, medications, personal care, rehabilitative therapy, psychosocial needs, and discharge planning. The plan of care is reviewed and updated as needed based on your changing needs, and you will be given a copy of the changes as the changes are made. Teaching and instruction will be provided to assist you in participating in your plan of care. You, our customer, are very important to us, so please ask any questions if something is unclear regarding our services or the care you receive or fail to receive. You may receive a call or receive a customer satisfaction survey in the mail inquiring about your satisfaction with our agency. If you do, please answer the questions and complete and return the survey in order to help us improve our services to you. Patient and privacy rights are as follows. You have the right to know why we need to ask you questions. We are required by law to collect health information to make sure that you get quality health care and that the payment from Medicare and Medicaid is correct. You have the right to have your personal health care information kept confidential. You may be asked to tell us information about yourself so that we will know which home health services will best meet your needs. And we keep everything we learn about you confidential. This means only those who are legally authorized to know or who have a medical need to know will see your personal health information. You have the right to refuse to answer any questions. And we may need your help in collecting your health information, but if you choose not to answer, we'll fill in the information as best we can. You do not have to answer every question in order to get services. You have the right to look at your personal health information, and we know how important it is that the information we collect about you is correct. So if you think we made a mistake, ask us to correct it. If you're not satisfied with our response, you can ask the Centers for Medicare and Medicaid Services, the Federal Medicare and Medicaid Agency, to correct your information. Notice about your privacy for patients who do not have Medicare or Medicaid coverage or private insurance. As a home health patient, there are a few things that you need to know about your collection or our collection of your personal health care information. Number one, the federal and state governments oversees home health care to be sure that we furnish quality home health services and that you in particular get quality home health care services. Number two, we need to ask you questions because we are required by law to collect health information to make sure that you get quality health care services. And number three, we will make your information anonymous. That way, the Centers for Medicare and Medicaid Services, the federal agency that oversees this home health agency, cannot know that the information is about you. We keep everything we learn about you confidential. The notice of information practices is contained in a notice of information practices that's described in this book. It describes how medical information is used and disclosed by Phoenix Home Care, and you can get access to this information. Review the documents enclosed in this book carefully. We have just summarized our responsibilities and your rights in this book. But for a complete description of information practices, please review the entire notices. Our responsibility is we are required to maintain the privacy of your personal health information. We provide you with the notice of our legal duties and information practices with respect to information we collect and maintain about you, and we abide by the terms of this notice. Your rights is that you have the right to request that we use or disclose your health information in certain ways. You have the right to request to receive communication in an alternate matter, a language, or location. You have the right to access and obtain a copy of your health information. You have the right to request an amendment to your health information, and you have the right to receive an accounting of disclosure for your health information. We reserve the right to change our information practices and to make the new provisions effective for all health information we maintain. Should our privacy practice change, we will update our policies and procedures and this notice accordingly. A copy of the revised notice will be available after the effective date of the changes upon request. We will not use or disclose your health information without your authorization except as described in this notice. If you have any questions and would like additional information, you may contact the Privacy Office at Phoenix Home Care LLC 630-321-9400. Statement of Illinois law on advance directives and DNR orders. You have the right to make decisions about the health care you receive now and in the future. An advance directive is a written statement you prepare about how you want your medical decisions to be made in the future if you are no longer able to make them for yourself. A do not resuscitate or DNR order is a medical treatment order that says cardiopulmonary resuscitation will not be used if your heart and or breathing stops. Federal law requires that you are told of your rights to make an advance directive when you are admitted to a healthcare facility and home health. Illinois law allows for the following three types of advance directives: a healthcare power of attorney, a living will, and a mental health treatment preference declaration. In addition, you can ask your physician to work with you to prepare a DNR order. You may choose to discuss with your healthcare professional and or attorney these different types of advance directives as well as a DNR order. After reviewing information regarding advance directives and a DNR order, you may decide to make more than one. For example, you can make a healthcare power of attorney and a living will. If you have one or more advance directives and or a DNR order, tell your healthcare professional and provide them with a copy. You may also want to provide a copy to family members, and you should provide a copy to those whom you appoint to make these decisions for you. State law provides copies of sample advance directive forms. In addition, your nurse can provide a copy of these forms and a copy of the Illinois Department of Public Health or the IDPH Uniform Do Not Resuscitate advance directives when you request them. Here are your patient rights: to have his or her property and person treated with dignity and respect, to be free from verbal, mental, sexual, and physical abuse, including injuries of unknown source, neglect, and misappropriation of property, to be protected from discrimination based on your color, national origin, disability, age, religion, or sexual orientation. Make complaints to the Phoenix Home Care regarding treatment or care that is or fails to be furnished, and the lack of respect for property and or person by anyone who is furnishing service on behalf of Phoenix Home Care. To be informed of his or her rights and exercise their rights during service delivery by Phoenix Home Care, and to be informed both orally and in writing in advance about the care and treatment to be furnished, including the disciplines that will furnish the care and the proposed frequency of the visits. To be informed of the right to formulate advance directives prior to care beginning or at any point during service delivery. To participate in planning care and treatment or changes in care or treatment, including the right to refuse all or part of his or her care to the extent permitted by law after being informed of the expected consequences of such action. To have the patient's family or representative exercise all of the patient rights if the patient is incompetent. The confidentiality of all records will be maintained in accordance with federal and state laws. Phoenix Home Care's policy and procedure states that records will not be disclosed without the client's notarized written consent except when required by law. And all records will be protected from unauthorized disclosure, use, or loss. To express their pain and have that expression accepted and respected as the most reliable indicator. To have their pain assessed systematically and thoroughly, managed according to the most currently accepted practices, received a prompt response to unrelieved pain, and receive education related to the management of their pain. To be advised of any changes in the information provided when they occur as soon as possible in advance of the next home health visit. To be informed that the agency can be reached 24 hours a day by calling Phoenix Home Care at 630-321-9400. Although not requested or required, we request that if you have any complaints, questions, or concerns, you first attempt to resolve these with us. To voice grievances regarding care and treatment that is to be furnished, lack of respect for property for anyone furnishing services on our behalf, and if the services are not started properly, without coercion, discrimination, reprisal, an unreasonable interruption of services for doing so. Complaints can be addressed to any Phoenix Home Care staff member or can be given to the clinical supervisor or administrator by calling 630-321-9400. To have Phoenix Home Care investigate complaints regarding treatment or care that is or fails to be furnished, or regarding the lack of respect for the patient's property by anyone furnishing services on our behalf, and have documented both the existence and the resolution of such complaints. To be informed of the availability of the State Home Health Agency hotline. The State Home Health Agency hotline is 1-800-252-4343. Its hours of operation are 8:30 a.m. to 5 p.m. The purpose of the hotline is to receive complaints or questions about local home health agencies. The patient also has the right to use this hotline to lodge complaints concerning the implementation of the advance directive requirements. In addition, you may contact the Joint Commission on Accreditation of Healthcare Organization at 1-800-994-6610 or email complaint@jointcommission.org for unresolved concerns related to patient safety and or quality of care. To be informed of all items and services furnished by or under arrangements with the Phoenix Home Health Care for which payment may be expected by a third party, pay, or any items or services not covered, and the changes of those items or services. To be informed of any changes in the coverage or the changes for items and services for which the individual may be liable, within 30 calendar days from the date the agency becomes aware of such change. Be informed at the start of care the names and primary staff and supervisory personnel involved in his or her care, and to refuse any staff member from entering their home. To be informed of Phoenix Home Care ownership and control, as well as any relationships the organization has that may bring profit to the agency when making referrals. To be informed of any experimental treatment or research and not receive such treatment or participate in research unless the patient gives documented voluntary informed consent. to be informed of the right to access auxiliary aids and language services and how to access these services, and to have the home care staff to obtain the ability to communicate in a language or form that patient client can reasonably be expected to understand. Whenever possible, the home care organization will provide or assist in obtaining special services, interpreters, or other aids to facilitate communication. To be told on request if the agency's liability insurance will cover injuries to its employees when they are in the client's home, and if the agency insurance will cover theft or property damage that occurs while the client is being treated. To receive all services outlined in the plan of care. To have clinical records kept confidential. To be advised of the extent to which payment for Phoenix Home Care Services may be expected from Medicare, Medicaid, or any other federally funded or federal aid program known to Phoenix Home Care. To participate in, be informed about, and to consent or refuse care in advance of and during treatment with respect to completion of all assessments, the care to be furnished based on the comprehensive assessment, establishing and revising the plan of care, the disciplines that will furnish care, the frequency of visits, expected outcomes of the care to be furnished, including patient-identified goals and anticipated risk and benefits, any factors that can impact treatment and effectiveness, any changes in the care to be furnished. To be advised of the changes the individual may have to pay before care is initiated. The care the agency believes that may be non-covered care. To receive proper written notice by Phoenix Home Care in advance of a specific service being furnished. In advance of Phoenix Home Care LLC reducing or terminating ongoing care. Must also comply with requirements of 42 CFR 405 through 1200 through 405 through 1204. Patient and representatives, if any, have the right to be informed of Phoenix Home Care policies and transfer and discharge policies. Have the right to be advised of the names, address, and telephone numbers of the following federally funded and state funded entities that service the area where the individuals reside: the Agency of Aging, the Center for Independent Living, Protection and Advocacy Agency, Aging and Disability Resource Center, Quality Improvement Organization. Patient or patient's representative also has the responsibility to be present at home at the agreed upon time, understand and accept consequences of not following the plan of care, participate in the development and review of the plan of care or services, select a provider of care in accordance with the provisions of the Medicare Freedom of Choice requirements, provide complete and accurate medical history and or social information necessary to understand the aspects of the patient's disease, health status, or physical condition. To read and ask questions about all forms and other documents which are requested to be signed and request further information about anything not understood. Adhere to the plan of care developed by the patient, Phoenix Home Care staff, and the physician as a condition of service or continued service, and comply with the physician's signed plan of care even after discharge from home health services. Take an active role in identifying specific activities necessary for care in order to achieve a successful outcome of all treatment goals. Caregivers and patients' representatives have to provide care to the patient in an emergency situation or when Phoenix Home Care services are unavailable. Attend all required pre- and post-discharge education lessons. Learn of self-care activities. Prior to going home independently, demonstrate the ability to perform the procedures needed to provide care. When at home, request accept additional instruction and or assistance as deemed necessary. Provide all information for medical care reimbursement in a timely fashion, including accurate insurance information to assure benefit coverage can be verified. Pay invoices as agreed upon and identify the need for financial assistance. Adhere to reasonable rules imposed by Phoenix Home Care staff as a condition of services. Respect the staff and property of the organization. Thank you for accepting Phoenix Home Care to be your home health provider. Please sign the consents provided to you to begin home health services with Phoenix Home Care LLC.